Hi everyone. Since we can't get together physically because of COVID-19, I decided to do my presentation for Workshop 5 um, by video, so you could all see it. I'll also send out an attachment with the little study notes if you want to put them in your book or binder or whatever you keep. So my topic was insulin shock. Basically, insulin shock is severe hypoglycemia because you have too much insulin. How do you get too much insulin? You could take too much. You could miss a meal or not eat. You could throw up your meal. You wouldn't throw up the insulin, you would just throw up the food. Maybe you did something unusual, some unusual amount of exercise, some excessive exercise, and didn't adjust your carb intake for that. You might burn off sugar that is needed. And you could also go on a bender, drink a bunch of alcohol and not eat. And you could overdose on hypoglycemic meds, especially those who are type 2 diabetics. So what's happening when you've got too much insulin is that sugar is all being taken out of the blood and turned into glycogen. So your body's going to store it. It's taking it out and it's putting into cells, all the sugars into cells. We're having glycogenesis, the making of glycogen for storage. So there's no sugar left in your blood. It's all going into your liver. It's all being stored in these nice little bundles of glycogen for later use. The problem is you need it right now, and there's nothing left in your body. So when your body's low on sugar, you're going to see some deficits in your central nervous system. It needs sugar to function. So people are going to be fatigued and weak. They're going to be weak. They're going to be confused. Some kind of altered state. They might have tremors. All kinds of things. Headaches. And it's also going to affect your central nervous system because it's going to stimulate. This decrease here is going to stimulate your central nervous system, and your heart rate's going to go up. So you're going to get tachy. Tachycardia is pretty common with insulin shock. Eventually, your blood sugar is going to get so low, you're going to actually be seeing some really bad things. You're going to see seizures. You're going to see a coma. And eventually, this is a life-threatening disease. And you're going to see death. Your patient's going to die. So if we treat them, which we can, what do we need to do to treat somebody who's hypoglycemic? We need to give them sugar. Probably first of all, we're going to give them some O2 right off the bat before we even get into drugs, because we're going to do vitals because we're paramedics. And then we're going to get them to have some oral glucose. If they can maintain an airway, oral glucose is going to help. And the big one for us now that we're paramedics, we can do IVs. So we're going to do an IV of D10W. That's going to bring up their blood sugar. We're going to do 100 mils. Do a bolus of that. And if we're not successful with our attempts to IV, what else can we do? We can do glycogen. Or glucagon, sorry. Glucagon. There we go. I'm no Jeff Murphy. So glucagon, what's glucagon going to do? It's going to help break apart those glycogen molecules and turn them back into glucose. We still have too much insulin, so the insulin's going to try to make it into more glycogen, but glucagon may help. So what else can we do with this person? What are we going to do? We're going to transport them. hopefully they return to some kind of normal state. But especially if your patient's been seizing or if your patient is a type 2 diabetic, we want to transport. Lots of times type 2 diabetics get into this situation with new meds, or if they double up or take too much of their meds. So, and their meds are also a slow release. So over time, so the symptoms can reoccur quite rapidly. So we'll want to keep monitoring their blood sugar, maybe on a maintenance drip, and transport them right away. Type 1 diabetes patients may have experienced something like this before and may feel like they don't want to transport. I think depending on, I would encourage transport. I think we all should encourage transport, especially if the patient has been seizing or was had any loss of consciousness. What's going to be good for your handoff report is some patient history. Has the patient recently changed medications? What were the precipitating events? Like, how did this happen? Did they miss a meal? Was it brought on by exercise? These are all important things that the hospital will want to know. And it'll make you look really professional if you get these all down before you come in and they ask you questions and you don't know the answer. So that just about sums it up, I think. If you've got any questions, you could email me, or comments, email me. And yeah, I look forward to seeing you guys again, hopefully sooner than later, depending on how this whole thing pans out. Yeah, take care.